Hello, my name is Cortland Hodges, and I will be doing a speech of nomination for healthcare workers. If we are going to fight a disease, let's fight the most terrible disease of all, indifference. This quote from Patch Adams, a movie about a real doctor that started the Gesundheit Institute, raises a characteristic that many people lack in the present day: the idea that status has overcome natural human decency and compassion. That is why I'm very happy to nominate a special group of people for the Patch Adams Award for Human Service. Our doctors, nurses, and other healthcare workers that are at the front lines of a pandemic currently affecting the entire world. Between the many examples of these workers risking their lives to help others, treating their patients as humans in need, and limiting their connections with their families and distancing themselves so that they can limit the spread of the virus. With all of these examples, we see that these workers deserve this nomination since they exemplify the virtues of courage, empathy, and prudence. To understand why they deserve this nomination in every way, we need to understand the three virtues. First of them being courage. If you look at Nicomachean Ethics, a book by Aristotle, you see that he says that courage is someone who is fearless in face of an honorable death, and of all the emergencies that involve death. Now, I'm not saying that workers are ignorant of the dangers of COVID-19 or other diseases. No, it's despite all of these, in spite of all of these, they continue to work to help make sure that people are constantly cared for and tended to when they need it. And even with the many people that are denying the impact of this virus, with all of that, workers are still working and being infected, and some have actually died from it. But even in these cases, some of these infected workers have continued to be courageous and heroic in their actions and all that they do. J. Ronald Verrier, a trauma surgeon at St. Barnabas Hospital in New York, is a fantastic example of one of these workers. As Sarah Varney of The Guardian says, Verrier, in his final weeks, continued to tend to patients with COVID-19 up until the point that he found out himself he was infected in early April. Even at that point, he continued to call into meetings all the way up to his death on April 8th. This shows that these workers are constantly working for human service, since they will risk their lives and even in the face of death will continue to help others in whatever way they can. Moving from that, we see that risking yourself doesn't just involve courage. We see that it involves empathy for the ones that you're trying to save. The Internet Encyclopedia of Philosophy mentions many aspects of empathy that these healthcare workers have. They use the Good Samaritan parable to say that that anyone that shows empathy is receptive of someone else and how they're being affected by a situation, their understanding of how they can help this person, and they're able to interpret the person in many different ways. Daisy Doranilla, a nurse at a correctional institution in New Jersey, perfectly holds to these standards. As Christina Jewett of The Guardian says, despite the fact that many of these prisoners were there for heinous crimes, she continued to care for them and treat them with no judgment or discrimination. She loved her neighbors by treating these people that were there for heinous crimes with respect, care, gentleness. This is just another example of how these workers continue to help other people and do it in human service at all times. Moving from these risks, we see that these workers must also have prudence, since prudence allows them to think rightly of the situation so that they can continue to make right choices about it. Going back to the Internet Encyclopedia of Philosophy, we see that prudence is one of the four cardinal virtues. They use Aquinas' moral philosophy to say that prudence is a kind of intellectual aptitude that allows and enables us to make judgments toward the end of human good. And we can see that with these workers, since they, with the fact that Emma Gray Ellis of Wired says that they have had to make tough decisions to help limit the spread of the virus itself. For example, we see a nurse in Portland, Oregon, who's living in a truck camper right now in her hospital parking lot to avoid spreading the virus. Others have actually had to move into hotels that are leased by local officials, and some have actually ended up living in their cars. Not even looking at the amount of emotional stress this has on the workers and their families, we see that they're able to make hard and wise decisions that help us by limiting the spread of the virus. That's just another example of how they're being in service of humanity. Now, if you look at all of these examples, we see and we understand, you must understand now, why they're deserving of this award for human service and care. They have the courage to risk their lives every single day to help others in need. They have the empathy to care for all those people with no judgment and no discrimination, because that is what they do. And they have the prudence to make choices that help limit the spread of the virus by distancing themselves from their families. Of the many people that are deserving of a nomination for human service and care, these workers deserve it, since they have gone above and beyond in all that they do for human service.